One of the most dramatic changes that happens to us as we age is the volume loss in our face. Observe the changes over quite a few years. Same individual, fullness of the eyes, around the cheeks and the jawline, and even in the lips. So our plan today is to restore some of this volume by fat grafting from the tummy and the hip area into the pre-designed areas. Here, there, there, and there. Now we're just injecting so we can harvest the fat. I'm actually filling the tissues with an anesthetic solution with a little bit of epinephrine to minimize any bleeding. We're going to harvest some from the tummy area and some from the right hip. Now we're going to start with the suction. This is a device that's called a LIPOSUCTION, and it harvests the fat by sucking right through here and trapping them in a net that catches them. We used to centrifuge them. We found that with this system, especially if I express it under the same amount of low pressure, we get very little extra fluid. So you see the fat slowly collect in this little net. It's a vacuum cleaner with its own vacuum bag. And I'm performing a mini-liposuction. Often we're asked by patients, can you take a little bit more? But really it's very inefficient if we're trying to do large volumes because we're going at a much lower pressure so as not to harm the fat cells. Now we're ready to transfer what we've caught. And when we transfer, we apply low pressure, and you can see that the fluid kind of being squeezed out of it. We've got 5 cc's there, and that's okay because she's had previous work on her tummy, so we're going to get quite a bit more from the hip roll area. This is one of the more abundant areas, and usually one hip is a little bit fuller than the other. We use different size harvesting poles to obtain different size packets of fat. Around the eyes and lips we prefer the smaller packets, and the cheeks we'll use the bigger ones. With this one being a little bit more aggressive, we often revisit areas that we've already harvested with the puncture. We just put just enough fat as we withdraw. That's a thread of fat so that it can grab blood supply within a few hours. If we just put it all in one area, then it would just calcify and die. And again, feathering, make sure we don't get lumps, or trying to remember where she came from as far as volume. It was very big cheeks, but there were no sharp breaks, so we can try to make this smoother transition. And then fill up the temporal area. This is the before the fat grafts 3/4 view, and afterwards you see the natural softening of the face as we return volume to where it used to be. One more time. Before the fat grafts, afterwards. The post-operative appearance after filling the cheeks, the temporal areas, the area above her eye, and the lower lip and the corners of the mouth. In this view, you can see that the lower lip has recessed and lost more volume than the upper lip. Naturally, the upper lip is fuller than the lower lip, but not to this point. It almost looks like she's biting her lip. You also see the volume loss beneath her cheekbone, behind the chin, and in front of the jowl are also areas that we're going to target with volume. This is after the fat grafts. The lower lip is still behind the upper lip as it should be, but it's now abnormal volume. The corners of the mouth have been brought out and filled, and the areas beneath the cheeks have been softened. Also the temporal hollows, and actually the fat pad above the hollow of the eye and just below the eyebrow.